Public Affairs programming on WQPT is brought to you by the Singh Group at Merrill Lynch, serving the wealth management needs of clients in the region for over 25 years.
A medical professional wants your help to go to Congress. And will your vote count this year? What's being done to avoid voter fraud in the cities? Will your vote count, or will someone else's count more? Voter tampering, voter intimidation. In a moment, we'll look at what's done to protect the vote you cast. But first, voters in Iowa's Second Congressional District could put a doctor in the House. Coralville surgeon Dr. Christopher Peters is the Republican candidate challenging incumbent Democratic Representative Dave Loebsack. We had hoped to have both candidates join us, but Representative Loebsack declined. Dr. Peters accepted. So joining us is the Republican candidate for Iowa's Second Congressional District, Dr. Chris Peters. Thank you so much for joining us. We do appreciate it.
Thank you for the invitation.
Tell us a little bit about yourself and also why, in particular, did you decide that you wanted to run for Congress?
Well, yeah, I am a surgeon. I went to University of Kansas for college and medical school, got my Army training, my first residency in the Army, spent 9 years in the Army and did my thoracic residency at the University of Oklahoma. Married a farm girl from northern Iowa 22 years ago and moved to Iowa 12 years ago. My interest in running is really to make sure that we're leaving behind a better country for future generations. My wife and I are the parents of 3 teenage boys, 2 in high school, 1 in college, and the trajectory that our country has been on for the past several decades I don't think is one that's sustainable, and I'd like to change course.
In the past, you've been kind of associated more as a libertarian than a Republican. Are those two different things, or how do you see that as far as your political views are concerned?
Well, there is a strong liberty movement within the Republican Party, so I think that it's not inconsistent. Certainly we see some people like Rand Paul, Justin Amash of Michigan, and Thomas Massey of Kentucky, some Republican senators and representatives who have strong libertarian views. So it is just one of many different factions within the Republican Party.
And as you said, Rand Paul is somebody that you were supporting. So I mean, if somebody wanted to get a kind of an idea of your affiliation or your viewpoints, that would be a person that you emulate. It
would, yeah. I wouldn't say I agree with every single viewpoint lockstep with anyone, but Rand Paul would be a good example where I lean.
Cedar Rapids Gazette did a profile on you saying that you'd help make Congress less partisan and less dysfunctional. Well, good luck with that, I guess.
Yeah, exactly, right?
How do you think that would be possible?
I don't know that it is, but I think it's something that's going to have to change. We cannot continue with this partisanship and this rancor. So something that can't continue forever is going to end. So I think you can serve as an example of how to behave better. We certainly do that as parents. We try and emulate to our children how we expect them to behave. I'm not comparing all congressmen and senators to children, but sometimes the comparison might be apt.
But you look at the Republican right now, Republican Party, and you're looking at Paul Ryan, the leader, and it sounds like there's going to be revolt, after the November election. I mean, are you worried about the party atmosphere, let alone the Democrats, the Republican Party, as you go forward after this election?
I am. I think both parties are due for a strong inward look at themselves and what they stand for. Parties are never monoliths. They're always constructed of various amalgamations of separate interest groups that come together with some enough shared viewpoints that they can work together. I think it's this remaking of the Republican Party is probably more imminent, and is going to be more of a fundamental change than it's going to be on the Democratic side. But I think both parties are going to be facing that kind of existential look at their future.
As a doctor, as a surgeon out of Coralville, you have a unique view as far as the Affordable Care Act, Obamacare, Medicare, and other issues involving health care in America. Repeal, reform, what do you want to see done with the Affordable Care Act?
Yeah, and it has, and also I'm also a small business owner and occasional patient, so I also get those viewpoints as well as being a physician. I think that the Affordable Care Act has some good points in it. For example, as I mentioned, my oldest, Julie's our oldest son, is in college now, and he can stay on our insurance plan until he's 26. And there's some other things that are
universally accepted.
Everybody likes that, and there's a number of other issues there that are things have been added with the Affordable Care Act that I think are good. So I think there are some fixes that you can do without repealing or defunding the Affordable Care Act, and that would be my emphasis going forward. I think there are different things that we could drop in to nudge the healthcare system in a direction that I think it needs to go, which is to have more market-based influences, more market-based incentives, and be more focused on patient care, patient-centered as opposed to insurance and government and that kind of role. So a patient-centered, market-based healthcare system, I think, is where I would like to see us go, as opposed to a single-payer healthcare system, which would not be my preference. But if we really want to have that discussion, let's have that discussion and go one way or the other at this point.
Now, the key is to insure more people. The other key is to bring down or at least stop the acceleration of the cost of health care. Do you see both as integrally important? I mean, are both equally important as far as healthcare in America is concerned?
I do, and I think the costs are probably the most crucial one. I think if costs were lower, then health insurance costs would be lower, and then insurance would be more affordable to more people without necessarily a mandate and all these other types of things that the Affordable Care Act tried to create. So I think the focus should be first and foremost on reducing costs, but also providing a low cost, ideally a high deductible kind of insurance plan for those that need insurance and can't otherwise afford it.
Well, as you said, market driven is your preferred way to go, but I mean, what is the role of government in healthcare?
Right. Yeah, I think that government can establish some necessary baselines for insurance, what we do want to see. I think the very basic healthcare plan, and this would be the one that most people, if they don't have serious and ongoing chronic health issues, should want, would be a high deductible insurance plan like my wife and I and our family has had for the past several years. It's no longer available since the Affordable Care Act. Our policy has been grandfathered in under the Affordable Care Act, but our policy costs our family of five about $250 per month premiums. So, and if we had to replace that now, it would be anywhere from 4 to 10 times more expensive. So there are good options out there. So again, some nudges in the right direction would be bringing back a high deductible insurance plan paired with a health savings account for people who, again, don't have any serious chronic ongoing issues. There's a number of other elements that I would like to see that would be important, but I think the end result would be, over time, you would see patients be more interested and in knowing what their healthcare options are, what their costs are, what their alternatives are. That would drive down costs overall in healthcare, and therefore result in lower premiums ultimately in the end. So insurance would be more widely available to everyone else. And I think we can still pursue that option while providing a social safety net for those that truly need it. So provide that insurance coverage and or at least subsidize it to some degree with a basic plan like that.
Discussion about the Medicare system as well. I mean, Republicans are looking for perhaps a voucher system. Also, there's discussion about perhaps moving the age of eligibility from 65 to 67. Are these areas that you support as well?
I think I've looked more towards, again, these more fundamental market-based reforms for Medicare as well, for those that it would be appropriate for. And it's going to be something, I think, if we were to do these market-based reforms and then were to fast forward, say, 20 years in the future, we're looking at people who have been on a market-based plan for a number of years, and then they're entering retirement. Mm-hmm. They have a much better understanding of how to shop and compare with regard to healthcare costs and prices and advantages and disadvantages. It's going to be a little bit harder for current retirees, maybe adapting to that type of a plan, but it's not insurmountable. Remember that physicians, I think, are supposed to provide the important role of not only providing care, but we should be doing a better job of explaining the underlying condition the patient might have, the alternatives for treatment, help the patient be an informed consumer rather than merely a passive recipient of care.
Well, we've got budget issues that are coming up as well. Yeah. The federal budget pretty much, let's just say, expiring in December. I think it's the 8th or December 9th. $600 billion deficit in the budget that already started October 1st. Let's start with that. I know it's going to be during the lame duck session, so that you may not be in a position right then, but what do you think Congress should do as far as spending is concerned and the growing deficit in America?
You know, it's the deficit, the debt, overall debt, that is one of the biggest reasons I decided to run. I think we are leaving behind a huge deficit for future generations. I think that's fiscally responsible and morally as well. We are currently nearing $20 trillion in total debt, as I'm sure you know. And if there's no changes, we're projected there will be at least $9 trillion more added in the next decade. So this is something we do need to address. And for the most part, seems like most politicians from both parties really dance around the issue and aren't talking about it in a substantive manner. The healthcare spending we were just talking about is a quarter of the federal budget each year and growing rapidly with inflation, and certainly as more retirees go on to Medicare rolls. So I think this is one area where there's a nice dovetail between my interest in healthcare reform to reduce the costs and improve the access and quality of care will also help with our rising debt. There's a lot of other issues. I think all issues need to be discussed substantively. For the most part, politicians seem to be quite willing to offer fairy tale solutions. We're going to grow ourselves out of the economy. We're going to eliminate waste, fraud, and abuse. That's lovely if we grow ourselves out of the economy. It's lovely if you find waste, fraud, and abuse that we can tackle. But realistically, the big budget items are, things like Social Security, their health care,
the entitlement programs, absolutely,
defense budget, and ongoing interest on our debt. And so those are the big items. You need to look at the spending side. You need to look at the revenue side, which is taxes. And make an honest assessment of what's possible.
If elected, one of your first big votes could come in March, when they're going to be asking whether or not to raise the debt ceiling again. It seems to be coming up every 18 months. So how would, knowing what you know now, would you vote to increase the debt ceiling if that vote comes up in March?
I would have to kind of see where we're at. That's a little projecting too far ahead. But I think that most Americans are upset with the gridlock in Congress. I would like to see us move towards biennial budgeting in the federal budget. So we're creating a budget for a 2-year frame rather than every year. And of course, we're not even doing that. So and I think we need to see some problem solvers in Congress who are willing to actually make a stand and do something useful moving forward. At this point, I think that extending the debt ceiling is probably the prudent thing to do, but only if we've got some agreement among people on both sides of the aisle to actually move this, make some substantive changes.
I want to get into two other issues, one very strong in the Republican Party, one very strong in the Democratic Party. Start with the Republican Party, and that's immigration reform. Donald Trump saying build a wall, but there's more to it than that. What do you think has to be done by Congress in order to have any true immigration reform for the United States?
Right. I think that the Senate was on the right track a few years ago when they had an immigration reform bill that passed the Senate and then was never taken up by the House. I think we've become very, simplistic in our thinking regarding immigration, that all immigration is bad and we need to eliminate all of it. The fact is that we all here in America are ultimately descendants of immigrants. I guess you could possibly exclude the Native Americans who were, of course, they immigrated here too, but they were here first. We have always been a nation of immigrants. I think that contributes to our strength and our resilience. I think we do need to look at solutions that are actually practicably possible. There was an interesting study that came out a couple years ago looking at the increase in the Border Patrol ages from 1980s to 1990s, and the result was that it didn't reduce immigration, but it reduced how frequently those immigrants migrated back, so they actually stayed here longer. So you always have to look at the unintended side effects of our policies, and as well as the cost. So just building a wall, well, great, how much is it going to cost? I don't think Mexico is going to pay for it, but I think we do need to look at some meaningful immigration reform, recognizing that certainly for people who come here legally, they're always a net positive for our economy. They're more likely to be job creators and entrepreneurs. But I think even those people who have been here, who maybe have come here illegally originally or overstayed a visa, but have been here a long time, are not criminals, are contributing to society. We need to find a way to offer them some kind of security in the form of, some type of permanent status.
And one last question that has to do with the Democratic issue, and that would be student loan forgiveness, student funding, actually, higher education. You live in a university town, Coralville, as well as Iowa City. You see this firsthand, I'm sure, and as you said, you have children.
As well, have one in college this year, right?
So, I mean, there's talk about, some types of loan forgiveness or even some forms of less expensive or even free education in state schools. How do you see that moving forward? Because it has become such a huge burden on America's youth.
Yeah, it has, and this is again one of these issues that I don't think anybody's talking about seriously. So offering fairy tale solutions like we're going to make all college, community college free or all college free or whatever, there is no such thing as a free lunch. And so I think you really need to look at the underlying cause of why has tuition gone up and what can we do to address that underlying reason, those underlying reasons. There are two important ones that I think are relevant. One has been the availability of government subsidized loans and grants, and there was a study by the New York Federal Reserve in 2015 that looked at the rising costs of tuition and looked at a variety of different factors, and the one that stood out for them was the availability of subsidized loans and grants. So if you subsidize something, you are going to increase the demand for it and increase the cost for it. So it's an unintended side effect of a well-intentioned thing. We thought, well, let's provide money to help people go to college, but the result has been, at least in part, that it's driven up the cost of said college. The other big factor that plays a role is that in today's economy, which is a knowledge-based economy, you really need a college degree, or on average, you need a college degree to succeed. Decades past, you might get by with a baccalaureate or associate's degree, and now you need, a high school degree or an associate's degree. Now you really need a baccalaureate degree or a master's or even a professional degree. And so with an increased demand for education and a relatively fixed supply of colleges and courses, you are going to expect to see a rise in cost due to that. I think ultimately the solution is going to be, and we will see this if we allow the market to work, is going to come from the technology sector. And we're seeing this already in some degree. We have online courses called Massive Open Online Courses, MOOCs. We have Khan Academy. My wife even finished her master's in health administration 20 years ago or something like that, at a time when we were still on dial-up modems through Central Michigan University. So I think if we allow markets and technology to work, they're going to deliver other options to us rather than everything being done at a traditional brick and mortar college or university. Well,
and like you said, it's good to at least have that discussion going on, because it is a situation that's getting out of control for a whole generation, it seems.
Right. If people are looking they're saying, I want an education, but that costs too much and I can't afford it, there is therefore a market that's going to be demanded to provide an alternative. And we're already seeing those markets develop. There are hurdles to overcome regarding making sure that we can verify that the information has been taught, the skills have been learned, that any schools have been, the course of study has been accredited in some fashion, whether that's in partnership with an existing institution or something completely separate. But I think those are hurdles that are overcomable if we just allow us to address them.
All right. Dr. Chris Peters, thanks so much for joining us.
I appreciate it. Thank you very much.
Republican candidate for the 2nd Congressional District in Iowa. Once again, we offered an invitation to both Dr. Peters and Congressman Loebsack to join us. Dr. Peters accepted. Representative Loebsack did not. In a moment, making your vote valid, what is being done in the cities to make sure the election is not rigged? American democracy is based on one person, one vote. And although there have been instances of voter fraud in the past and irregularities at the polls can always be expected, this election year has Donald Trump saying the election is rigged. Though surrogates say he means big media influencing the vote, Mr. Trump has made clear statements questioning the actual process of the 2016 election. And that has those who coordinate county and statewide votes, Democrats and Republicans alike, crying foul, saying voters can rest assured their ballot will count. Joining us now is Scott County Auditor Roxanna Moritz. And this is kind of you got a tough enough job, but to add this allegation on top of it, How do you handle that? I mean, is this election rigged, and can an election be rigged?
Well, obviously, I'm disheartened by the comments, but I welcome the opportunity to spend time with anybody that wants to come in and see how the system works. We had several people yesterday after the allegations have been made, and they came in, and I really do languish in being able to show them how it really does work, because once you show those individuals, they have a really die-hard attitude about, like, this system really does work, and they will continue to vote, and they'll share that.
Well, what is the biggest misunderstanding? Because I think, because we've been hearing about Russian hacking, we've been hearing about political parties and emails being hacked into, and you wonder, I mean, is there this big master computer that people can get into and change the vote?
You know, I think that is the biggest allegation, is someone could actually get into our system and change how people vote. And that just is not possible. And I think there's been several reports that have been put out about that. But first of all, most of our equipment's pretty old. If you look around the United States, most of our equipment is old. But in 2002, when the Help America Vote Act came out, we started systemizing looking like at each system in each state, making sure that it met the state regulations and then the federal regulations. So you could no longer have what was called a standalone system. You had to be hooked into what we call in Iowa, iVoters. Now, when we go out to the polling locations, we don't modem in, we're not hooked up to the internet, there's nothing that someone could hack into per se, because all we're doing is we're plugging into electricity to turn our machine on, and of course we use paper ballots. So there's always the opportunity for a paper ballot trail, so if someone wanted to question the election, we could recount.
Okay, and actually, I mean, after the election occurs on Tuesday, you guys go through an entire canvassing process anyhow, and you take a look at the vote before making it official. Everyone thinks that the vote totals that are released election night are official. They technically are not.
No, and it'll actually say these are the unofficial results. And why that is because each precinct will bring in what's called their eligibility slips. And every person that votes at that precinct signs an eligibility slip that matches a number that goes into the machine. And at the end of the night, they have to make sure and audit and make sure they both line up. If there's an anomaly or something happens, they'll write it down in their tally book. We'll take it the next day, we'll look at it, and we'll verify their numbers. And we'll make sure that everything lines up the way it's supposed to be before we give our official results. And then that's called the canvass. So you have your absentee board that will come in with any of those ballots that came in late, or maybe something that wasn't right. So we have an absentee board that looks at that and makes a determination. And that's party balance. So there could be 2 Republicans or 2 Democrats and 1 Republican. But there's always party balance looking at those things.
The other 2 areas are actually the voting on the day of the election. One area is registration for voting, voter registration, whether there could be fraud there. The other is voter intimidation, people who might be standing outside a voting area. What is being done to make sure that there's no voter intimidation at the polls?
Well, we, before any of this happened with the hacking and things, comments such as that, I've notified the police department, I've notified the sheriff's department, I've talked to the Bettendorf Police Department, and we have what's called rovers. So I have one person that does nothing but goes to 4 precincts and makes sure everything is on track. They have all of the equipment that they need, they have all of the signs that they need, they have all of the paperwork, and everything is really running smoothly. So they'll be roving those 4 locations, and then we'll just have extra patrol looking as well for voter intimidation.
Okay, and then regarding voter registration, I mean, a lot of people think you're going to find people that have been dead or people that really aren't citizens. How does that happen?
Well, in Iowa, because, and I won't say every state, but in Iowa, because we are paper ballots, just today I was in my absentee room and pulled out someone that passed away. So if you vote early and you have a ballot and you're in the obituaries or we're notified somehow that you've passed, you know, we actually pull those ballots out. So there isn't the opportunity for someone to pass away and actually vote. We'll pull that ballot. And as far as people with same-day registration, you have to show a valid ID that has a picture on it and that has an expiration date. And then same-day residency has to show a checkbook or a check, electrical bill, a phone bill, a mobile bill, something that shows that's actually your residency. And you have to remember, Iowa is a no residency requirement. I mean, they could move in a week before and be voting in Iowa. So, you know, as long as they can prove that they live where they live and they are who they are, we'll let them vote. And Iowa's just very liberal with allowing us, like we said, early voting earlier. We have 3 weeks of early voting going on, same-day registration. So, you know, we make every everything available for people if they want to vote to be able to access that.
And let's be honest, the easiest way to vote is to make sure that you voted before.
Right,
You
no
know, to be
lines.
honest, if you vote often, if you're a veteran voter, you just go in and out. I mean, it's a pretty easy process, which is what it's supposed to be.
It's not only easy, it's the ease of voting, but it's also the ease of like just going into a library. They're all handicap accessible. You know, there are no lines. It's still really nice outside, so you don't have to worry about the weather. And you can get that out of the way. If you've making your choice already, if you've made that choice and you've decided who you want to vote for, it really helps us out. So on election days, that's one less person that's in line. Because if all of our voters came, 126,000 of them
Right.
to the polls that day, you would have very long lines.
And let's be honest, that's what we used to see years ago, is these long lines, and people would say, I don't want to stand in this line, especially if the weather's bad. I'm not going to do it. What have you noticed with the early voting, either the satellite voting areas or the absentee ballot? I mean, it's becoming more and more popular before election day, is it not?
Right. 4 years ago, we saw 43,000 early votes, and that was just under 50% of our election. And then as I viewed what was happening around the country, Florida, Louisiana, where you saw all these long lines, it was because they weren't allowed early voting sites. They might have been allowed 1 or 2 days, but
Right.
not full weeks. So in Scott County, we have 3 full weeks. We really want to give people the opportunity that if they want to vote, that they have access to it, so that they don't have to wait in those lines. We want to make it available to them. It's their one constitutional right that they have to, you know, have that vote that represents who is going to represent them in the issues that they care about.
And the hours are pretty good. I mean, you've been trying to make it with Saturday offerings on Saturday as well. I mean, there's a chance to get out and vote.
There's always a chance to
Yeah.
get out and vote. St. Ambrose is 12 to 6 every day, Monday through Thursday. The other libraries are the library hours. Then, of course, our office is open, and we'll be all open on Saturdays, this Saturday and next Saturday from 8 to 5. So they're welcome to come down, and if they have any issues or they question whether they have the opportunity to vote, let's just say maybe a felon's not sure their rights have been restored, give us the opportunity to make sure that you have your rights restored or you don't, so we can help work getting them back for you.
And your website has filled with the information, particularly on where you vote if you want to show up at your particular precinct on election day.
Yep, you can just go on, put in your location where you live. It'll tell you your precinct. It'll give you a Google map, and you can just go from there and hopefully get out and vote.
Always want you to have your crystal ball nearby. So here's my question. You get these media calls on election day all the time. What do you think voter turnout's going to be this time around?
You know, right now it's trending towards a gubernatorial election, meaning there's not a heightened awareness out in the community. There's not a lot of yard signs. There's not a lot of whispering or talking going on. But we're still 3 weeks before an election.
Right.
The debates tonight, which is Wednesday. So we'll see what happens after that. And it's always campaign driven. You know, it's those campaigns that drive people to the polls. So we'll see in the next 3 weeks if they get them to the polls or not.
Roxanna Moritz, the Scott County Auditor, thank you so much for joining us. And long day coming ahead, the day before election as well as election day and after that, but we appreciate the work that you do. Thanks.
Thank you.
And we want to remind you that early voting is underway right now throughout Illinois and Iowa. You can vote early at your Illinois County Clerk's office or the Iowa County Auditor's offices Monday through Friday during business hours, as you heard. Satellite voting centers have also been set up in libraries in St. Ambrose University in Davenport and Bettendorf and Eldridge. And you can also ask for an absentee ballot, but election officials say if you do that, get the ballots soon so you have time to fill them out and send them to your county clerk's office or your county auditor's office. You can get information on voting by going to Google and typing your county clerk's office in Illinois or your county auditor's office in Iowa. A lot of information that you can get. It's all at your fingertips. On the air, on the radio, on the web, and on your mobile device. Thanks for taking some time to join us. We talk about the issues on the cities.
Public Affairs programming on WQPT is brought to you by the Sing Group at Merrill Lynch, serving the wealth management needs of clients in the region for over 25 years.